Welcome to Shaping Healthcare, a podcast by Citius Tech. Some of the great minds in the world are constantly striving to solve the healthcare industry's greatest challenges with technology, creativity, and agility. With every episode of the Shaping Healthcare podcast, we will take you deeper into the world of healthcare and life sciences and give you a perspective into what it takes to build a human-first, technologically enabled healthcare world. I'm your host, Laurel Rockall.
Joining us today is Benjamin Heck, a distinguished figure in the healthcare consulting arena, currently serving as the global head of Citius Healthcare Consulting at Citius Tech. With an illustrious career spanning over 2 decades, Benjamin has been instrumental in driving strategic growth and operational excellence within the healthcare technology sector. His leadership spans pivotal roles across health plans and consulting firms, where he has spearheaded transformative initiatives in IT implementation, strategic consulting, and business development. Benjamin's deep expertise in navigating the complexities of the payer market, coupled with his visionary approach to leveraging data analytics and AI, positions him at the forefront of industry innovation. Passionate about enhancing healthcare delivery through technology, Benjamin brings a wealth of insights into the evolving landscape of value-based care, consumerism in healthcare, and the strategic imperatives facing payer executives today. We are honored to have Benjamin Heck join us to explore the future of healthcare technology and the critical role of leadership in shaping industry outcomes. Benjamin, welcome to the podcast.
Oh, thank you so much. It's a pleasure to be here, and thank you for that warm introduction.
It's a pleasure to have you, and I'm really looking forward to our conversation today. I want to start first with the big picture. So, Benjamin, given your extensive experience, could you provide an overview of the current dynamics in the healthcare sector, and how is the industry evolving in response to rapid technological advancement and regulatory changes?
One of the consistent things we can always say about the healthcare market is it is always changing and evolving. So that is not new for this period of time either. Again, my focus is mostly on payer and payer trends, but if we look at sort of the macro things that are going on in the market right now, from a payer perspective, government programs is a huge part of what payer executives are thinking about right now. Medicaid and Medicare and ACA are all very important parts of strategy there. Optimizing systems and processes for efficiencies is a huge part of what payers are thinking about. We continue to have the evolution from fee-for-service to value-based care and risk agreements. And then the rise in consumerism is a huge part of what payers are dealing with now as well. Digital innovation and digital engagement, for sure. On the provider side, they're also dealing with fee-for-service to value-based service contracts. We're seeing a shift in care locations from more inpatient and outpatient to virtual and even home care in some instances. Providers are also dealing with consumerism, giving their patients the data they need to make good decisions about their health and wellness. And then finally, we're seeing an evolution of providers getting into the payer market and becoming more payviders, where they're taking on the risk and delivery for their membership. From a life sciences perspective, we've got AI becoming more important part of our drug discovery and clinical trials. Precision medicine really focusing on the individual and what they need for their particular comorbidities. And then finally, we've got the evolving regulatory landscape that's also impacting life sciences from an out-of-pocket and a cost reduction perspective. And the themes that are really cutting across the whole industry are improving efficiency, reducing costs, improving quality. We continue to see that shift from fee-for-service to value-based contracts. Data interoperability is going to be a huge part of the future, and breaking down the silos of data and making it more accessible across systems and industries. And then we're going to continue to see the consumers march towards wanting better data about themselves and the decisions they're making in their own care. So kind of the global macro view of what's going on in the market today.
You mentioned the digital side of things, and as well as just many evolving dynamics there, a lot of things going on. So with that in mind, let's dive into that digital revolution that's going on. How is digital transformation reshaping the healthcare sector? Can you share some examples of some emerging technologies and how that's helping patient care?
Yeah, for sure. And it's across industry too. So not just payer, provider, or life sciences, but really across the whole industry. They're looking to deploy digital to improve efficiencies, better engage with members, improve outcomes using more robust analytics. And And a huge part of what we're starting to see the evolution of is Gen AI across the industry. So from a payer perspective, we're seeing AI being used in customer service to help de-aggregate data that the customer service reps are using to answer questions and make that more efficient. Looking for efficiencies in claims processing and prior authorization is also where we're seeing some AI deployed in the industry right now. Providers are using it for back office operations and improving their sort of RCM. And we're also seeing it integrated into the EHRs and better use of visit summaries and documentation suggestions that are really helping providers be more efficient from their perspective. And even Citius Tech is deep in Gen AI in the industry. So we're using it to help payers reduce costs through prior authorization efficiency. We're using machine learning models to improve engagement as well as cost of care. Accelerating interoperability as well to provide onboarding. So and accelerating interoperability across the industry is a huge part of what we're seeing from a Gen AI perspective in the industry. We'll talk a lot more about technology used across the industry as we go through this, but I think that's probably one of the areas where we're seeing really interesting early innovation. There's still some concerns about, how safe is Gen AI? Is it going to take over my business, et cetera? But the reality is we're seeing more and more use cases where it's actually adding efficiency in the system and really helping our constituents.
Yes, it's certainly Gen AI and just all these technological changes in any sector is such a big hot topic today. But your expertise being really in that payer market, that's what I want to get to next. I want to focus it in a little bit more and focus on that payer market, particularly where are these leading trends? What are the leading trends that payers are dealing with in today's healthcare market as everything's changing?
Yeah, and some of the things we mentioned above, but we'll dive into a little bit more detail about each one of them. But government programs is huge in the payer market right now. Right now, Medicaid plans are going through redetermination. So they're having to basically re-enroll all of their membership. As we came out of the COVID pandemic, there was some loosening of the Medicaid rules for health plans. So they're having to re-enroll all of their membership against the standard Medicaid rules. And in some cases, we're seeing 25 to 40% drops in membership. And we're seeing a change in the risk profile for those members too. So they're a little bit more sick in many instances, so the risk profile for the health plans is starting to favor towards a more risky population as well that they're going to have to deal with. From a Medicare perspective, enrollment continues to grow, but the amount Medicare is going to be paying in premiums is going to be decreasing over the next few years. So they're doing a 10% rate cut from a Medicare perspective. So plans are very much focused on risk adjustment, quality, market entry, compliance, and process efficiencies when it comes to government programs. Another trend is they're looking hard at their systems and processes to make sure that they're operating as efficiently as possible in sort of this changing and dynamic market. They're looking for new ways to engage their members. We talked about that term consumerism earlier. And all health plans are really looking for unique ways to engage their member through content, apps, mobile devices, wearables, et cetera. And then we'll talk about VBC a little bit more, but that transition continues. It's not going at the pace the industry expected it to, but we are seeing that it's starting to pick up pace, and CMS is starting to put some guidelines out where they're requiring people to move to VBC in the near future. So those are kind of the big trends. I'm happy to dive into any or all of those in a little bit more detail if you'd like.
Sure. Well, I'm going to jump on the optimization piece there first. So system optimization, process optimization, just really become so crucial in healthcare and the healthcare landscape. And from your perspective and your experience, what are some innovative approaches or technologies that payers are adopting to help streamline their operations and improve that efficiency?
Yeah, it's a very good question. I mean, health plans traditionally run on very, very thin margins. So anywhere they can find process or system optimizations that will help with efficiencies, they're really looking hard to do that right now. So just starting with process, I mean, they are doing basic process redesign, trying to knock inefficiencies out of the market. From a process perspective, they're obviously looking to improve efficiencies in their day-to-day operations and processes. They're inserting things like robotic process automation and AI that we mentioned earlier, to look to figure out ways to add efficiencies to their processes and knock out some costs. From a core system perspective, there's only about 8 to 10 major core system vendors that are out in the market. That the vast majority of the health plans operate on one of those 8 to 10 core systems. And like the health plans, the core system vendors are having to evolve their technology and their functionality to meet new standards like value-based care as an example. So one of the things that health plans are going to have to consistently do is look to upgrade and adjust their systems and take advantage of new functionality that's being released from their vendors, and then adjust their current processes and technologies around those new functionalities. And kind of the third main bucket of items that we're looking to do operational and technology improvement around are really around RAP applications. And I think Citius Tech's Perform Plus applications are a very good example of that, where we've got Perform Plus regulatory, Perform Plus stars, Perform Plus contracts, all niche systems looking to provide specialized functionality around government programs, stars, provider networking and contracting. There is a whole myriad of these RAP technologies that are out in the market that health plans have to decide if they're right for their business, how to implement them, when to implement them, and then take into the account the cost of implementing those as well as the ROI. So lots of trends in the core system and process area.
You've also mentioned consumerism in healthcare a few times throughout our discussion so far, and we'd like to talk a little bit more about that, because that is something certainly that is on the rise, and that is influencing how the payers are interacting with the members, and we have an increasingly empowered healthcare consumer. How do you see this trend evolving? What strategies are payers employing in order to meet those expectations of the consumer?
That's a good question. And it's a little bit of the Wild West right now. Everybody's got different strategies through different technologies and different opportunities. So maybe I'll hit just some of the broad categories where we're seeing member engagement and consumerism. First, I'll say that right now consumers are more than ever in the healthcare market becoming more informed buyers and users of the healthcare system. So they want to know about the quality of their providers. They want to know about the cost of their providers. They want to know where they're going to get the best bang for their buck, especially as their share of the cost becomes increasingly more through high deductible health plans and those kind of things. Mm-hmm. And we're seeing health plans deploy a number of different technologies or options, if you will. So I'll just kind of talk about them in general terms, but you've got sort of online portals, and these are sort of the table stakes that have been out in the market forever. But, the places where members can go get their benefits, their drug formularies, understand their provider network, et cetera, is a basic form of member engagement. We've got mobile apps that are becoming more and more active where benefits are on the go. These apps can include things like digital ID cards, claims trackers, provider search tools, et cetera. We're seeing more and more chatbots being deployed in the healthcare field where we've got actual automation that's answering basic questions or doing basic guidance around wellness topics and those kind of things in the market. Telehealth is huge. So we've got the fact that we can go to virtual visits now, and we can do follow-ups from procedures through virtual visits that, in the past may have been missed because the individual or the patient couldn't get back to their follow-up visits. We're seeing more and more of that deployed from a telehealth perspective. And then finally, another category is digital wellness. So wearables, fitness trackers, healthy eating, stress management resources. Those are all things being offered by health plans through digital engagement to help improve the outcomes for their members.
And you mentioned value-based care a few times as well. So I want to jump on each one of these things that you were talking about, because there's so much to talk about in each one of these. And that transition to value-based care models is a significant industry shift. And so what challenges are payers facing in this transition, and the strategies that you found that to be effective in accelerating that adoption of value-based care initiatives?
Yeah, and this term kind of came to the market in a big way, say 5 to 7 years ago, and I think everyone thought the transition was going to be extremely rapid, and we would be already to a place where value-based contracts were 75, 80% of the way spending is done in the market. But that just hasn't been the case. And there are some challenges around that are very real that we're still working through. I think one of the realities that's starting to set into the market is basically CMS has said they want the majority of their spending to come through value-based contracts by the year 2030. So that's only, 5-6 years away at this point. So we do expect that we're going to see the transition to VBC continue to accelerate. But I did mention some of the challenges that are out there. So there's data challenges. So we've got siloed systems where data lives in different systems throughout the health plan and throughout the patient data experience. So trying to figure out how to make that data interoperable and accessible is going to be a huge part of the continued transition to value-based care. We still have a very fragmented delivery system. Even though we have tight provider networks, I could just use a personal example. I've got a relative in my family who has Parkinson's, who recently fell and broke her hip. And just through that experience, she's had hospital, ortho, PT, OT, rehabilitation hospital, home health care, and now is in assisted living. And to think that the coordination of that care is happening efficiently in the market today, it just is not. This is a tangible example. She's on a pretty tight drug regimen, and that drug regimen didn't get passed to the rehabilitation hospital correctly. And they gave her drugs that she probably shouldn't have taken. Just as an example of how this is the reality of how the system works in the U.S. today. And breaking down that fragmentation is going to be a huge part of making VBC successful. We've still got some providers who are a little bit concerned about taking the financial risk for membership. And then finally, and kind of maybe most importantly, is most of the members' health is actually impacted outside of the delivery system. I mean, so where they live, how they live, the habits that they have, genetics, actually play a larger role in overall health and safety than the delivery system itself. So there are some real challenges out there, and there are some technology or initiatives that can help break those things down, but it's going to take some time. The whole idea of data integration and data interoperability is going to be huge. There is some legislation that's pushing the industry towards interoperability, but it's not there yet. We can use data to find people's comorbidities. We can find that out genetic precursors. We can personalize treatment plans for better awareness of social determinants of health as well. So just using data in a better way is going to become more important. Continue to use telemedicine to help people get access to care that they otherwise might not get because of the difficulty of even getting to a provider is going to be huge. Streamlining administrative workflows and what we've talked about a lot is the patient engagement tools again. So personalizing engagement in such a way that it takes into account their social determinants of health, their history, their genetics, their habits, et cetera, and really personalizing medicine towards them is where we're going to kind of go in the future, I believe, as well for BBC.
Thinking of a theme throughout each of these things that you're saying is that the integration of the data, the interoperability, personalized medicine, like all these different things I feel have this sort of thread running through them of the technology, bringing them all together and having this really transformative potential for the healthcare. And a lot of times what comes in there is AI, artificial intelligence, such a hot topic. And it does have a transformative potential in healthcare analytics and that clinical decision making. How do you, Benjamin, envision AI in shaping the future of payer organizations in terms of improving their outcomes, reducing costs, and enhancing member satisfaction?
Yeah, I mean, and we're at the early stages of AI deployment throughout the healthcare system, and it's more ingrained in some areas than others. But I think you did a really good job summarizing some of the main areas where we're starting to see early proofs of concept in AI. So, if we look at just from an improving outcomes perspective, there's better predictive analytics that can be deployed through AI. So looking through disparate data to find trends in your health and then more accurately and acutely look at what your potential health outcomes are and how to improve those. Personalizing care. We talked about all those lifestyle factors, genetics, data, claims data history. So doing more personalized care around your specific needs is another thing that AI can do to improve outcomes. Reducing costs. We're seeing it used more and more in fraud detection. So where there's those sort of anomalies in billing and claims activity that we can pick up in from a fraud detection perspective. We hit on efficiency of operations a little bit, but using AI in basic administrative tasks like claims processing, billing, and customer service is one that's also seeing a lot of activity where sort of in the last 10 years, as a customer service rep, you might have to reference 10 different things to actually answer a question.
Yeah.
AI can bring those disparate pieces of data together and answer it much more rapidly on behalf of the member and add some efficiency to the customer service rep's job as well. And then around member satisfaction, the whole idea, again, of personalizing member engagement based on your particular criteria, improving access to care. So helping identify gaps in care and then connecting with the member to actually drive them to the care that they might need. So diabetes is one of those where you see a lot of individuals that don't necessarily take care of the full spectrum of care they need. And we can use AI to better sort of hone in on that. And then again, health and wellness programs. So based on my criteria, again, what's the most likely best outcome for me from a health and wellness perspective that's going to really drive results. So again, these are all just sort of pockets of where we're seeing AI deployed, and every health plan is doing proof of concepts in some way, shape, or form, and looking at the ROI related to those things to see how the outcomes are coming through. It's going to be very interesting to see over the next 5 years, just like AI in the rest of our lives.
Right. Yeah, it is going to definitely be interesting. And yeah, there's quite a bit of potential there. And in light of all of these developments and these pockets, as you say, all these things that are going on in the ecosystem here of healthcare, how should payer executives prioritize their focus areas? Are there certain skills or capabilities that are becoming really essential for leaders when they're navigating these complex challenges?
Yeah, and just as a leader, not even in a health plan today, but as a leader, in an organization around health plans, I mean, just dealing with the sheer volume of change right now is can feel as an insurmountable task. So one of the things I recommend is really starting with your organization's strategy. So where do you see yourself going over the next 3 to 5 years? And most health plans have a 3 to 5 year strategy that they've laid out, that they maybe want to get into government programs, they want to exit government programs, they want to change lines of business, they want to become more involved in wellness and care, et cetera. So you've got this myriad of sort of tasks coming at you and organizing them around your strategic plan, and then using sort of a PMO type functionality to prioritize your projects against those strategic plans, or something that I've seen used very helpfully in the past. And just as a leader today in the healthcare industry, especially in payers, there's a million different things that you sort of have to be aware of. But if you look at some of the top, say, 5 or 6 things, I mean, understanding data and technology a little bit better. I'm more of an operations person, but having a better understanding of how data analytics and technology can change my business is important. I mean, cost management and efficiency is probably the biggest thing you could talk about right now in the healthcare industry. Is how do we reduce costs, add efficiencies, and try and improve our margins. Regulation compliance is huge right now. It doesn't matter which sector of the industry you're in. Dealing with Medicare, Medicaid, ACA compliance is a full-time job itself. So having some understanding of regulatory compliance is extremely important. And then I think, talking about partnerships and collaboration. So using your peers, understanding what's going on in the industry, collaborating with partners that are going to help you to your end state in a trusted sort of advisor way are all important to sort of managing through an executive's job on a daily basis today. So no small task in the industry as we sit.
Oh, sure. But many great points that you've brought up today, and ways forward with them, some strategies that executives are looking at. And reflecting on our discussion today, what are some key takeaways for healthcare payer executives They're looking to navigate the complexities of the market and have operational excellence.
Yeah, I mean, it's you kind of look ahead to the next 5 to 10 years, and it's you know it's going to change, and you know it's going to change fast. But I think the themes that are absolutely going to be here, that are going to be critical, are value-based care. You know, we've talked about it a lot in this particular conversation. It's not going away. It's going to continue to evolve. Medicare, Medicaid, ACA are all going to require those types of reimbursement in the future. And frankly, they're better for the outcomes of the member. If you take out sort of the per-click payment in the industry and you look at it more holistically from a health perspective, you know, it will improve the outcome for the members, which is what we all want, and ultimately keep people out of the system, which is more important than keeping people in the system. Another huge thing is just going to be data analytics and interoperability. So right now, again, the healthcare data is disparate across the industry. It's disparate across your own organization. Bringing data together to look for trends and improve decision-making is going to be essential over the next 5 to 10 years. You know, continuing to understand that consumers want the Amazon experience, not the disparate, one touch here, one touch there experience. They want to be able to go to one-stop shop, find out, you know, where they can find the best providers for their cause, how to keep themselves healthy. They want personalized data about their own situation and care, and how they can access the system in a more simplified manner. So that is not going away over the next 5 to 10 years. And then the last thing is that regulatory compliance adaptation. I mean, the CMS will continue to evolve rules. There will continue to be changes in the market that will, like interoperability right now is a perfect example where all the health plans are having to deal with how do we make our data interoperable with the market through our current systems and technology. And those things are going to continue to evolve over the next 5 to 10 years. And then lastly, I'll just mention again sort of that social determinants of health and how we're addressing those things outside of the care delivery system. You know, transportation, simple things like food and transportation can make an enormous difference to somebody's health and quality of life. So, there's a lot of different channels that can go down and different opportunities. And some of them aren't traditional providers anymore. So figuring out how to pay for transportation or housing or food or general wellness, those aren't traditional providers that you would get a claim from. So, understanding how you might work with those partners and reimburse for their services will be an important part of the future as well. So, like I said at the beginning, the one thing we know for sure is change is not going to stop. Innovation is not going to stop. So how we continue to evolve around these things is really going to be key for our business.
Yes, you're right. Yeah, change is not going to stop. It seems like it's so rapid, and it would be very interesting to see what these next 5 to 10 years and plus look like. And really appreciate bringing your expertise and having this discussion with me and sitting down with me today to talk about these things, as it's very important for the healthcare landscape. So thank you so much, Benjamin, for coming on the show today. Appreciate it.
The Shaping Healthcare podcast is brought to you by Citius Tech, a leader in healthcare consulting and IT services. To find out more about Citius Tech, visit citiustech.com. To listen to more interesting insights on healthcare technology and innovations, search and subscribe to the Shaping Healthcare podcast. Thank you for listening. If you want to share any feedback or would like to be featured in our podcast, do write to us at citiusvision@citiustech.com.